Hey everybody out there, it's Dr. Leath. Another one of these dental passenger talks. I like them. It actually cuts my commute time home down a little bit. And I get to talk to you fine people, whoever may be listening, and share some value, hopefully something that you can use. So I'd like to talk about the huddle. If you don't have a huddle, I highly encourage it. It sets the tone for the day. It clears everybody's conscience. You talk about important items that you don't have to bring up throughout the day. And I'll go through with you a little bit of what my huddle consists of. I have my admin team bring the scorecard book to the huddle. That's so that there's a sheet inside of it that says essentially, hey, what did we do last business day that we were open in terms of production? Now, I happen to be a little philanthropic, so I donate a percentage of all revenue to an organization that's near and dear to my heart, involving children. So they say how much we contributed because of what we collected the previous day. We go over any oncoming events and scheduled events, and we've got a Kanban board that I can kind of go through with you that's near our huddle table, which is essentially a long boardroom-like table. Fits 12 people or so. Everybody has their own seat. Everybody has their own executive pad to write on. Just brings us all together and puts us in the right mindset. Now that Kanban board is for another topic and another day, but essentially what it is a Post-its. It's got vertical columns, and it just moves those Post-its of items that we need to get done through this Kanban board, okay? So we visit that, and there's always somebody responsible for it that's on it, and it does help. So we've implemented that into the huddle. Then we go through the hygienists and the assistants talk about their patients who needs x-rays, anything special. If anybody has like a birthday coming up, something special like that. We talk about a VIP patient. We pinpoint a patient in the schedule who we call a very important patient, a VIP, and we give them a $5 gift card to Starbucks. I think it's great. That gift card essentially goes to the person who identified somebody, and they simply go up to them during the course of their appointment and they say, thanks for being a great patient. That's it. We don't want anything in return. We genuinely, authentically want to reward those patients that are good to us, because we want more of them, to be quite honest. It makes our day go by so much faster. And remember, it's not like the procedures that you have during the day that make or break your day. It's the people that you have during your day that make or break your day. And if you've practiced for any extended period of time, you will know what I'm talking about. So we go through that. And these huddles, by the way, are about 20 minutes long. Let's say our day starts at 7:30. We're down there at 7:10, and we're going. Everyone has their coffee. Everyone's talking. Now, I have to be honest. Does everybody like these huddles? No. Okay. I could do without it, to be quite honest with you, because I could just look at a schedule and be like, okay, yeah, I know what to do, blah, blah, blah. But it's not about me, or it's not about you. Like, there are people in this world that are like Excel nerds, right? And they got everything in format, everything in spread. I'm kind of that way, but I don't really need that. We all operate differently, but this is a time where we get to come together, we get to swallow our pride, and we get to listen to everybody. And it does create that cadence for the day, okay? It's really super important. Again, you might be the person that might not need it, but you know what? Swallow your pride, bite your tongue, because other people might. Other people do, okay? So that's what we do for our huddle. Highly encourage you, if you do not have one, get one. Or if you're working at an organization that doesn't have it, start small. Maybe you and another assistant that you work alongside come together and do your own little huddle. And people might see that and they might want to attach to it. So highly encourage it. Bring it to the table if you're not an owner of an organization and you'd like to get more organization and less chaos in the office. I think you should start here. All right. Hopefully that helps.